Good Health is sponsored by Horizon Health.
In today's Good Health, Horizon Health's diabetes education program continues to receive national recognition for its high standards of care. The American Diabetes Association acknowledged Horizon Health for its effectiveness in educating patients about self-management of the disease. They say that self-management is an essential component of diabetes treatment. Now, part of that self-care includes changes to a person's diet, exercise, and monitoring blood sugar levels. Horizon Health has maintained this recognition since 1994. Well, how children eat might be as important as what they eat when it comes to obesity and heart disease. The American Heart Association suggests creating an environment that supports healthy food choices without controlling what or how much they eat. The recommendation includes consistent meal times, letting kids choose the healthy foods they want, and then eating with your child. The statement also advises against pressuring children to eat more once they say they're full. Well, a new study links exposure to chemicals to an increased risk of celiac disease in children. Researchers at New York University compared blood samples from children newly diagnosed with celiac disease and those without the condition. The celiac patients were twice as likely to have high levels of chemicals found in things like pesticides, nonstick cookware, and fire retardants. Experts say that these chemicals are known to disrupt animal and human hormone levels. Well, a study of nearly 14,000 NFL players suggests that repetitive blows to the head could take a deadly toll. Syracuse University researchers created an impact index. They found players with the highest scores had an increased risk of death from any cause. Experts say the league may want to consider some rule changes or equipment changes to reduce these risks. Well, what if we could stop the spread of the coronavirus by using a red light to eliminate it? One company says it has the technology to make it happen. Lauren Petty shows us how it works.
It may look unusual, but this red light therapy could help stop the spread of the coronavirus.
This is a very simple intervention, couple minutes. It's inexpensive. It's portable. The machine's over my shoulder.
Dr. Nicholas Lobel is the Chief Technology Officer for Ondine Biomedical, a Canadian-based company with offices in Chicago that developed this SteriWave technology.
In our case, we don't see any adverse effects. Any significant adverse effects over a decade in 60,000 patients.
Approved in Canada for use before surgery to help prevent infections, including MRSA, Ondine Biomedical says photodisinfection can also fight this pandemic.
We know it works against this particular virus.
The process involves swabbing the nose, where studies have shown the virus tends to colonize with a blue-colored chemical compound, then using fiber optics to turn on a red light, which is visible light found at the safe end of the spectrum.
When you shine that light in the presence of the photosensitizer that's on the virus, it basically blows the virus up.
Dr. Merrill Beal has been studying photodynamic therapy since 1987 and says the science is there.
So it's really establishing the clinical trial. It's a very doable trial. It's a painless, short treatment.
Ondine Biomedical says studies are already underway in Canada, and they're in discussions with the U.S. Food and Drug Administration now.
We have been discussing with the FDA how we can move the system into the U.S.
The goal would be to disinfect frontline workers first, possibly after every shift. It wouldn't replace the need for PPE, but work in conjunction with it if the technology gets FDA approval.